me now is Dr. Kevin Kavanagh. He's a retired physician and founder of a national organization called Healthwatch USA. Good morning, Dr. K.
Good morning, Jack.
It's been a while since we did this, so let's talk about, for a minute or two, Healthwatch USA. What is it? Why did you start it, etc.?
Well, we're a nonprofit patient advocacy organization started about 15 years ago, mainly to look at promotion of patient advocacy, and safety was our motivating reason to start. And currently we are focusing on infectious diseases, and that has been the case probably for the last 10 years. And so this is why COVID-19 falls right into what we like to do and what we're knowledgeable about. We publish a number of articles in the peer-reviewed literature, let alone put on conferences, write op-eds, as you well know, and be on the radio. So hopefully we are getting the word out on how to avoid infectious diseases, how to stay safe, and please get vaccinated. That's the number one message for today.
And vaccines highly protective against COVID, according to some research. Is that right?
That's correct. This came out from Case Western Reserve. And we talked about this last week, and lo and behold, another article came out which is showing that if people are vaccinated, they, for example, only 1/5 is likely to die as if you're unvaccinated. And that's a big boost. Hypertension, again, 1/5 is likely to develop it. Diabetes, about 1/4 are likely to develop. Heart disease, 1/3 is likely to develop. And so the idea of getting long COVID, if you're scared of that, which certainly I'm very concerned, vaccines are preventive, and that's another reason to go out and get vaccinated.
And if you've gotten your 2 vaccinations and your booster, if you're in certain categories, you should go ahead and get a second booster, except I think they're recommending against the Johnson & Johnson product, right?
That's correct. The Johnson & Johnson product now is only recommended if you cannot get any other types of vaccines. And you want to get another booster if you are more than 50 years of age and older, and if you're more than 5 months out from your first booster, then you need to go get that second one. Again, it is felt to be protective against severe disease with Omicron.
Now, you mentioned certain things that are happening, conditions as a result of COVID. What about kidney disease?
Well, that's a new report out also on kidney disease with long COVID, that if you have COVID-19 and were not hospitalized, you don't have much of a chance, less than 1%. But if you are hospitalized, your chances of having long-term kidney disease, and this is at 6 months, is about 5%. If you're in the ICU, it's over 7%. So we've talked about heart disease on the show. We've talked about, of course, cognitive functions with brain fog, mental types of concentration difficulties. And now we're also seeing that if you're severely sick, if you're in the hospital, you're at risk for long-term kidney disease. So COVID-19, this is something that affects almost every organ of the body, and it's something you want to avoid. So it's not just dying, we need to keep you healthy. And the new research out last week confirms that vaccinations will help you do that. It helps you to avoid these long-term problems.
Anything new on the variant or offshoots?
Well, they're just increasing, and that's unfortunate. There's a variant, which I call the BA.2121, which is increasing in cases. It's almost up to 50% of the isolates, and overall cases are up in the United States, 25%. They're up in Kentucky, about 34%. Hospitalizations are also going up. So we're headed in the wrong direction. It is felt that at least with this variant that the vaccines are protective. There are other variants over in South Africa, which hopefully will not have a significant foothold over here, that appear to be very problematic with prevention from vaccines and previous infections, because South Africa is seeing a huge surge after 90% of their population has either been vaccinated or had a COVID infection. So they're in some trouble, and hopefully that won't happen over here. It may not. We've seen that with the Wu variant and the Lambda variant, where you're concerned about what happens in another country. But for some reason it doesn't take hold in our nation. So we'll just have to keep our eye on that for now.
I understand that another ivermectin paper has been retracted. That's over 10 now, right?
Yes. I don't know of any study right now which I would have faith that ivermectin works. I can't understand why it became so popular in the first place. I think this is all really disinformation, and it may well be organized disinformation. As you know, Jack, we've talked about paper mills, which are in Russia, they're in Syria, and a number of other nations that you just have to pay a fee and they'll generate you fake research, fake paper, everything, and you publish it. So you've got to be very careful pulling papers from this place or that place. You want to make sure they're from a reputable institution. And that's something that people, I think, have been led astray, and I believe it's going to cost lives. Some of our leaders have been touting this drug. And if you've got COVID-19, we have effective medications. There's paxlovid. Please see a doctor, get on that medicine. It's been shown to be highly effective in preventing hospitalizations and severe COVID-19.
As my wife and I were watching the Kentucky Derby, my wife mentioned to me, I wonder if this is going to be a super spreader. I know most people were outdoors, of course, but was there an increase following the Derby in Louisville?
Well, there is, and some of the epidemiologists think it's from the Derby and all the people coming in. Jefferson County went up a degree in risk and turned yellow. And so that's something that really we have to be careful. Just because you're outdoors doesn't mean you can't get this virus. That is for aerosolization. It will dissipate aerosols. This virus still spreads by large droplets. If you're within 6 feet of someone and they're shouting and producing droplets, you're likely to get infected. And of course, you also have problems of getting in and out of the venue. And if you have to go to the bathroom or you use common areas which are indoors, you will also be at high risk. And so it does look like this was a spreader event. I tell you, Jack, everybody's sick of COVID, but the virus is just using it to its advantage. It doesn't appear to be sick of us yet.
Thank you very much, as always. We appreciate it. Thanks.
All right. Thank you, Jack. Bye.
Dr. Kevin Kavanagh,
retired physician, and this organization that he's founded has grown by leaps and bounds, Healthwatch USA, if you want to get on there and check it out.